So this is my cervical spine video, and I'm doing part B of the proficiency. So we're going to start off with active range of motion of cervical extension. So what you're going to do, you're going to get your handy dandy tape measure, and you're going to measure from the chin to the suprasternal notch. And so you're going to measure them first in the neutral head position. So 0 goes on the tip of the mandible. Then you're going to find that notch again. You're just going to measure down to there. And so we're at about 14 centimeters right now. And so next, I'm just going to have her bring her head all the way back. All right? Yep, you want to do it one more time for me? And then you're going to put the 0 again, right at the tip of the mandible. Find that notch again, the suprasternal notch. You're going to measure that. And we're at 21 centimeters right now. So for this one, what you're going to look for is that the initial measurement is a shorter distance than the measurement after her head has moved. So next, we're going to do cervical rotation, active range of motion. So I'm going to have you in a neutral head position. We're going to measure from the chin, 0 goes in the chin again, out to the tip of the acromion, right at the edge of the shoulder. And we're going to measure that again. And she's at about 23 centimeters. And so now I'm going to have her do it herself. Can you rotate this way for me? All right. So we're putting the 0 once again, right at the tip of the mandible, finding that acromion process, measuring that out, and that's about 10 centimeters. And so for this measurement, you want the initial measurement to be a longer distance than the second measurement. And so next we're going to go into passive range of motion, and we're going to do passive range of motion of cervical flexion. So I'll have you lay supine for me right on your back, and I'm going to have her head off the table a little bit so I have room to move her head. I'm just going to hold her, grasp her right back here on the occiput, and so I'm just going to slowly bring her head up. How does that feel? Okay? Okay. And so what you're looking for here is a firm infield due to the chin striking the chest. And so next we're going to go right into passive range of motion for cervical lateral flexion. So we're just going to bring her head down to her shoulder, relax, ear to shoulder. And so you're also looking for a firm infield here due to the soft stretch of the muscles and the tissue. So I'll have you scoot back on the table. Or you can sit up, that's fine. Okay, and so next we're going to do manual muscle tests. And so we're going to do manual muscle testing of the cervical extension. So I'll have you flip onto your stomach so you can be prone. I'll stand this way so that you can see what I'm doing. So if you could scoot up a little bit more. Thanks. Okay, that's good. And so what I'm going to do first, I'm going to stabilize this thoracic spine, so right up here. I'm going to put my other hand right on the occiput right here. I'm going to have her bring her head up into my hand. As much as you can. Any pain with that? Anything going on there? Nope. Okay, great. You can put your head down now. Yeah. So the muscles that you're looking for being tested here are the cervical paraspinal muscles, the upper 1/3 of the trapezius, and the levator scapula. That's what I was thinking. And so next, I'll have you get up. You can sit around this area. And so next we're going to do manual muscle testing of cervical rotation. So you're going to stabilize one hand on the anterior shoulder, and you're going to put one hand right here on the temporal bone. I'm going to ask you to rotate your head towards my hand. And so you're just testing that there. And so for this one, it's best to be on the side, so that way you can put more force and more resistance against them when they're turning their head, especially if it's a bigger person. You want to make sure you can give them a good resistance. And so the muscles being tested are on the opposite side are going to be the upper trapezius, the sternocleidomastoid, and the multifidus muscles. And then on the same side is going to be your rotators that are being tested. And so that's all for all of those. So now we're going to move into special tests. And so the ligament test I'll be doing is the spring test. So I'll have you lay down, prone on your tummy. Thanks. And so you're just going to find these. So if you go to the occiput and you go down a little bit, you can start feeling those processes. And so you're going to get 2 fingers. You're just going to press down and go along. And what you're looking for is that nice little spring back. So you're just pushing all these anteriorly. And a positive for this test is going to be if the vertebrae do not spring back up, or it takes them a little bit to do that. And so implications for that are going to be hypomobility of the vertebrae, and especially in the fossa joints is where this could happen. And so next we're going to do the shoulder abduction test. So I'll have you sit up. And so for this one, you're going to want to stand right in front of the patient. And so I'm going to ask you to put your arm, abduct your arm, and touch the top of your head. And so you're abducting them to do this. And for this one, so you're going to want to test both sides. So you can do the other side too. Abduct, touch top of your head. Any pain with that? Anything? Nothing? Okay. Positive for this test is going to be if there's a decrease in symptoms when there's a decrease in the tension on the nerve roots. And so implications for this is going to be nerve root, herniated disc or a nerve root compression. And so next we're going to move on to Sperling's test. And for this one, I like to get behind her. And so we're just still going to have the patient seated. So I'm just going to get up here so I have better leverage. This table's kind of tall. And so what you're going to do is you're going to interlock your fingers, place those at the top of the head. And I'm going to ask you to extend your head back. And then if you can move your head to the side and flex your neck, there you go. And so what you're looking for is if there's any pain here radiating down your arm. Did you feel any of that? Any pain, anything? So what you're looking for is pain radiating down the arm. And so that's what's going to be a positive for Sperling's test. And implications for this are going to be nerve root impingement due to the fact that you're narrowing the intervertebral foramen. And yeah, that's that one. And so next we're going to do the traction test. And so for this one, you're going to put one hand on the shoulder and you're going to depress that down. The other hand's going to go right on the top of the head. And you're just going to, oh, are you doing it? Let me do it, girl. And so put it right on the top of the head, and then you're going to laterally flex the head this way. And so positive for this test is if there's any pain radiating down the arm. And implications for this, there's two different ones. So when I'm stretching her neck this way, if this arm is the one that's getting pain, that means there's going to be traction of the brachial plexus. And then if the side that's being compressed, so if I'm pulling her head this way, this side right here, if there's pain radiating down this arm, that means there's compression of the brachial plexus. Remember, all of these tests that are being performed, you do them both sides bilaterally. Just making sure I put that in there. And so next, we're doing the tension test for the median nerve. So I'm going to have you lay supine. You should probably move. Okay. Don't move your edge. Yeah, your shoulder at the edge of the table. And so this is going to be for the median nerve. And so when you're doing this, make sure at every joint position that you're doing, you want to make sure you're asking if they're okay. Because if at any point during the test there's pain, then that's going to be positive. So we're going to go through this. So you're going to depress the shoulder. How does that feel? Is that okay? All right. And so if I bring you out a little bit, abduct you 10 degrees, is that okay? And then externally rotate the shoulder. Is that okay? So if I extend your elbow out this way, how does that feel? Okay. And then if I pronate you out this way, how does that feel? Is that good? And then if I extend your hand and extend your wrist and your fingers, how does that feel? Is that okay? Now, if they don't have any pain during any of these, you're going to want them to laterally flex their head the opposite way to see if you can produce any symptoms. So ask her to do that. All right, any pain, anything going on there? No. Okay. And so for that one, implications of that is just going to be abnormal tension of the ulnar nerve. And then just remember, it's going to be positive if there are any symptoms during any part of this test. So next we're going to do the ulnar nerve, the tension test for the ulnar nerve. And so for this one, you're going to start out the same way. Depress the shoulder. Any pain with that? Anything going on? Okay. Abduct 10 degrees. How does that feel? Is that okay? And then you're going to externally rotate the shoulder. Is that okay? Anything? You're going to flex the elbow. Any pain when I do that? No. Then you're going to supinate the forearm. Any pain there? No. And then you're going to extend the wrist and the fingers. How does that feel? Any pain? No. Okay. And then once again, no symptoms have occurred, so I'm going to ask her to laterally flex the opposite way. Any pain with that? All right. And then positive for this test again is going to be if there's any pain during any joint position or any time during this test, then implications for this one are going to be abnormal tension of the ulnar nerve. And so next we're going to do the brachioradialis reflex test. You say that for me. So you're going to get your handy dandy reflex hammer. So we're just going to passively have her arms in this nice little position. And so what you're going to do is you're going to kind of turn it to the side so you can find that brachioradialis. right in here. Just hammer right there. You got it. And you're just going to tap there. And so what you're looking for is for a reflex of that. And so positive for this test is going to be if there's aroflexia, which means there's no reflex at all, or if there's hyperflexia, which means there's more than enough reflex, or if there's hypoflexia, which means there's not enough reflex, and that's going to be of the pathological reflex of the C6 nerve root. And so implications for this test are going to be, so once again, all these tests are bilateral, so you're doing both sides. So if I do this side and I do this side, and they're both like the same, like they're both hyperreflexia, then that means that it's an upper motor neuron lesion. And then if you're doing both sides, only one side is like normal and the other side is hyperreflexia, then that means, and it's like unilateral, then that means there's a lower neuron lesion. And so the last test we're going to do is the cervical vertebral artery test. So we're going to have you on your back supine again. You scoot back a little bit. And then you're going to hold the occiput, and you're going to want to make sure your head's off the table, so that way you're able to maneuver it a little bit better. So you're going to passively extend, laterally flex, and then rotate the head to that side. And so you're going to hold this position for 30 seconds. And positive for this test are going to be if they have any dizziness, confusion, nausea, or if there's unilateral pupil changes. So when you're doing this, you want to make sure you're monitoring the pupils to see if one's like dilating. And then implications for this test are going to be, you can go back. Implications for this test are going to be occlusion of the cervical vertebral arteries. And that's the end.